Hey everyone, it's Marvin. Today's clinical case study, is going to be about carbon monoxide poisoning. Let's jump straight into a case study. We have a 19-year-old student, let's call her Claire. Claire's brought to the emergency department by her friends, who are just about to go on a night out, and they notice that actually she's not feeling very well, and they're worried enough, they've brought her in, and they see that she's thrown up a couple of times. She seems really confused, out of herself. She's not her usual self, a little bit drowsy, and mentions that she has a horrible, horrible pounding headache, which she keeps going on about. So let's imagine that you're the emergency department doctor. You have this young woman who's come in who's looking not very well. So the first thing you do is you take a nice thorough history. History just means talking to the person or whoever is involved and getting an idea of what's been going on, because you're not going to send off tests, start doing examinations, all this stuff before you've spoken to the person and you know what's going on. So this is what we're going to write down. Following the standard medical history format, the presenting complaint, the reason that she's come in is actually because she's had this vomiting, 2 episodes of vomiting, which has happened twice. And her friends are really worried about that, and that's the reason they brought her in. But when we go into the history of that presenting complaint, we see that actually she had a headache, and it started on Tuesday, a couple of days ago, and that happened just after a heating tradesman fixed her heating. And now she's been vomiting twice in this evening, and she's feeling quite tired and quite confused, and you can probably tell that when you're talking to her. So when you ask about any past medical problems, past medical history, no, not really. The occasional migraine, and that's the only thing. She's not taking any medications, no drugs, no allergies like hay fever or peanuts or anything. And when you ask her just a bit about her life, which is really, really relevant, as you'll see, you find out that she's a second-year biochemistry student, and she's living in student accommodation at the moment. And when you're asking about this, her friends make a comment that she's been really unlucky, and she's got a really, really sort of old, shoddy student accommodation. She's not very happy about it. So the next step after you've taken a history is to do the examination. Now, in medicine, you never work alone, almost ever. There's always people around you. There are nurses, there's pharmacists, there's a whole range of people in the hospital. And so nurses, one of their jobs is to get observations for patients. And observations can be things like blood pressure, which involves a cuff around the arm. It can be things like getting your temperature. They put this little probe just in the outer part of your ear. And they also put on, as a standard thing, they put on what's called a pulse oximeter. It's that little machine on the bottom right. It just sits on your finger. It doesn't hurt or anything. It just opens up and you just clamp it over your finger very lightly. And what it does is it shines a light through the fingernail, I believe, and the amount of light that comes back is an indication of how much the hemoglobin in the blood is carrying oxygen, and it gives it as a percentage. So you can have 100%, which means there's 100% saturation. Every bit of hemoglobin has got some oxygen, or you could have a lot lower, 90, 80, now you're getting very worried, 70, this is really critical. But anyways, her pulse oximeter, it says 100, and as you're looking at that on her finger, you realize that her hands are really red, which is quite unusual, and it's warm in the department. You're wondering, why are her fingers so red? So putting two and two together, you're thinking you've seen a young, otherwise healthy woman who's come in with some vomiting, some confusion, and a bad headache, and she has this red colouring on her fingers, and all of this started when someone was tinkering with the heating system in her very old student accommodation. So all of these things point toward carbon monoxide poisoning, which is exposure to carbon monoxide. Can happen in especially older homes, student accommodation, industrial buildings as well. And carbon monoxide is CO, and hemoglobin has a much, much higher affinity for carbon monoxide than oxygen, which means that essentially the carbon monoxide will bind much more tightly to the hemoglobin molecule. A little kind of clip cartoon you can see there. On the bottom we have carbon monoxide saying, haha, from now on we are inseparable, and the hemoglobin in red saying, yes, the love of my life. And the oxygen looks really sad and upset because the oxygen can't now bind onto the hemoglobin very well. And that's the issue with carbon monoxide, because if carbon monoxide is binding to hemoglobin and it's forming carboxyhemoglobin, this it's not very good at carrying oxygen. It doesn't bind oxygen very well. So you can say it has a low oxygen carrying capacity. And that's a problem because obviously we need oxygen for all of our tissues, for respiration, for all the processes, the cellular processes in our body that allow us to live. At the moment, you're fairly sure that you've picked up a case of carbon monoxide poisoning, but now you need to order maybe some tests, some investigations. You're thinking about, do you need to send off for any imaging like X-rays or CT, MRI scans? You're thinking, do you need to talk to anybody else, maybe someone more senior, or a different team in the hospital, maybe the heart team, the cardiology, maybe the respiratory team, the lung and the breathing people. You decide the first thing you're going to do is you're going to get a blood test. You're going to get some blood from the artery. So you're going to use a needle, pop it in the artery to get a really precise oxygen reading. And that's a bit painful, but you're doing it because actually Claire, our student, is not looking very healthy, and you want to be really sure what's going on. How much oxygen is there actually? Because we're not getting an accurate reading from our pulse oximeter. So besides getting that blood test, you'll also send off for a second blood test, which is to measure directly the level of carboxyhemoglobin. And so that's going to confirm your diagnosis, whether you were right, whether this is carbon monoxide poisoning, and then you can treat it just like that. And the treatment, the first thing you treat it with is to give pure oxygen through what's called a non-rebreather mask. So if you look on the bottom right here, it's just a mask that sits over your face. They connect it to the wall and they turn on the oxygen tap, and you'll get hissing as the oxygen's coming out. And what happens first is that this bag you can see connected to the bottom of the mask, that bag is going to fill up with oxygen. And then every time someone breathes in through this mask, the air they're getting is coming from the bag, which is pure oxygen. So they're getting 100% oxygen. And the reason why that's the treatment is, number one, she's probably low on oxygen because of the high carboxyhemoglobin. And the second reason is because it helps to clear the carboxyhemoglobin, which goes away faster. And so after 6 hours of treatment, she's looking a lot better. And they send her home with a letter to the GP saying, if anything gets worse, etc., make sure to come back. And there we go. So we've talked a little bit about carbon monoxide poisoning, what it looks like, and how it's treated.